First responders and other healthcare professionals are on the front lines of the COVID-19 fight every day. Fox 44's Cameron Stewart, he's live in the studio tonight after talking with one ER doctor about the changes they have had to make over the last month. Cameron?
Hey Adam, Dr. Jill Beatty from Premier ER in Waco tells me their number of patients have actually gone down recently, but even then, they can't be too cautious.
As providers, we also wear goggles, masks, gowns, hats, shoe covers.
Healthcare professionals are having to layer up to protect themselves from the coronavirus. The workers at Premier ER treat patients and assist paramedics every day, and there are plenty of precautions to take.
The paramedics have protocols in place for infectious disease at all times, but now with COVID, they're all wearing masks, gloves, and any suspected COVID patient gets a higher degree of personal protective equipment.
While workers have to be extra cautious every day at work to stay healthy, they also have to make sure they take measures not to bring the virus home to their families.
Most of the people I work with, the providers here, are changing clothes in the garage, showering, leaving shoes and all equipment away from the family. It's tough. You want to know that you're doing the right thing and you don't want to put your family at risk, but your family needs you.
For these healthcare workers, the disease itself is not the most worrying part of the pandemic.
As humans, we like to know what's going on and we like to have a plan, and I think with a novel coronavirus, there's just some degree of uncertainty that we have a hard time grasping, and I think as a provider and a mother and a wife, the concern for taking it home to your loved ones is, for all healthcare providers, really on the top of our minds.
The spread of COVID-19 has shut down Waco and communities all over the nation for weeks now. Not even the people working on fighting the virus every day know when the pandemic will die out.
It's not just one event and then we're having to deal with this. This is an ongoing event, and it's kind of like a moving target. You're not kind of sure from day to day how much you need or what you need to do to be prepared, and I think that's the biggest challenge.
Dr. Beatty also said that although they have less patients coming in, the ones they are getting are a lot sicker patients than normal. Live in the studio, I'm Cameron Stewart, Fox 44 News.